Today we're going to discuss briefly the procedure that you're about to have. You've been referred by your physician for a pain management procedure, either involving your lumbar or your cervical spine. We will go over the basics of why we do the procedure, and then we'll head over to the scanner briefly and show you a brief introduction as to how the procedure will go today. I wanted to briefly take a few moments to explain the basics of the procedure that we're doing and why. The second type of procedure we frequently do, which at times is done in conjunction and or separately from the transfemoral epidural steroid injection, would be what we call a facet block. Again, if we go back to our model, you can see that almost as if a ladder, the vertebral bodies are held together. Typically in the setting of arthritis, these facet joints will often enlarge with the lining of the joint becoming inflamed, and these are often a source of back pain. These joints typically cause pain localized to the back. This procedure is directed at those patients who are having pain directly within the back, almost a localized pain. Often patient can actually, what we say, point directly to the site, or point tender, and or describe pain going from side to side across the low back. Same situation lying on the CAT scanner, exact same technique as epidural steroid injection, however, slightly different positioning of the needle. Our goal is to simply position the needle directly in that small joint, make a small injection of, again, steroid and long-acting Novocaine type medicine in order to quiet down or de-inflame the tissues. In the majority of patients who are having what we call facetogenic or facet-related pain, one injection is sufficient. However, particularly in patients with significant arthritis, oftentimes we'll get temporary and or partial relief. In that setting, we have a second procedure, which is called a medial branch block. What that entails is simply moving the needle slightly lateral or off to the side. Again, under CT guidance, this would be done on a follow-up basis. And what we're actually doing there is injecting the very small nerve that does nothing at all in your body except give you sensation to that small joint. It's one of those nerves that we wish we probably didn't have. That is the source of pain when this area inflames. And we find that in those patients that get temporary or partial relief from the facet injection, if we move out and do the medial branch injection, the vast majority of those patients will get further resolution of their symptoms. Also, for those of you who are here for a cervical injection, either into a cervical facet or a cervical transfemoral epidural steroid injection into the neck region, I wanted to tell you that basically everything is exactly the same, but you can see here when we use our model, this is a model of the cervical spine, again, would be roughly about like this on me. The anatomy is much more compact and a little more difficult to point out. So I chose to use the lumbar anatomy and the lumbar model just to make it easier for you to see and understand what I'm talking about. But otherwise, the procedures are exactly the same, other than, of course, rather than working in your lumbar region, we'll be working in your neck. In summation, facet injection, again, typically more arthritic patients, more localized back pain. Place the needle directly into the facet joint, small injection there, hope to de-inflame the joint and hope for permanent relief. However, in a percentage of patients that the inflammation may return, in which case we then proceed to our next injection, which would be medial branch block, injection of the same cortisone material, etc., but this time into the very tiny nerve that, again, has no other function in your body but to give sensation to that small joint. We find that in the majority of people who have partial or temporary relief to that facet injection, they will get more permanent and or improved results with that medial branch block. In conclusion, we appreciate you coming and trusting your care to us today. Millenium Physician Group, one of our strongest attributes is the integration of care that we have here. So the ability of your primary care physicians to get timely and accurate information to us on the radiologist/pain management side, and our ability to access your images directly is a very key link that makes our practice the best it can be and allows us to take the best care of you, our patients.